Like I said, when I was diagnosed with Lyme disease, I knew nothing about it. I knew nothing about treatment. I didn't know what it would be like going forward. And one of my biggest questions was treatment. I didn't know anything about it. It wasn't too long until I started seeing a doctor that helped me. I see a naturopath doctor, and whereas before I never would have thought to see a naturopath. She's helped me a lot, and I'm really grateful. So my doctor is integrative, so she works both with supplements and antibiotics. Which is essentially, it's like the main treatment for Lyme disease. If you were to like be in a hospital or see a MD, they would prescribe you antibiotics. The Lyme disease bacteria is a little aggressive, I guess, smart, I don't know. So you'll start taking antibiotics, say amoxicillin, and the bacteria will hide. If you take, like, say, amoxicillin every day, then the bacteria gets used to amoxicillin and will rest in, like, your muscles and tissues and hide from the amoxicillin until you stop taking. So you think you're better and you stop taking it, then the bacteria will come out and be more active. So my doctor, what she does is, when I was first diagnosed with Lyme disease and started seeing her, I was on three different antibiotics every day. And then after a couple months, she switched over to what she calls pulsing. And I was prescribed 4 different antibiotics, and I would take I would concentrate on one for 3 days, and then switch to a different one for 3 days, and a different one for 3 days. I did that for a few weeks, and now I'm closer to remission. I'm just on 1 antibiotic. Along with that, I've been on quite a few supplements. I want to say, I know it's not a lot compared to a lot of other people with Lyme disease. I take about 20 pills a day. And it can be hard at first because there's like a schedule that you're on. You take some with food and some without food, and you'll take some with like 2 hours away from your antibiotics, and your antibiotics in the morning and at night. So it's hard to get used to. But now that I'm going off of my antibiotics, it's hard for me to remember that because I'm on a lot less than I used to be. So it's hard to remember to take them, I guess. Yeah, for me, I have been lucky enough just to be on oral antibiotics. They do have IV antibiotics, and I know that's fairly common. That's one, my doctor at first, when I first met with her and let her know my medical history a little bit, she wanted to put me on the IV antibiotics because from what I understand, that works better if you're having neurological symptoms, and that penetrates better. She started me off on oral antibiotics to see how I did, and I responded really well. So she's just kept me on oral antibiotics this whole time. But I am a little bit nervous to go off of antibiotics completely, which will be for me soon in the next month or 2. Because I've been on them for so long. I guess I don't know how I'm going to react, so that worries me a little bit. But I need to trust my doctor. I know she's been right on about everything so far. So people with Lyme disease, they do a lot of different things. Some people treat without antibiotics, and they'll just do all natural. And some people are just strictly supplements. Some people strictly diet. Some people even essential oils. And so yeah, everyone does a little bit different. It's kind of like what works best for you. And every doctor has a different protocol. And some, like I said, my doctor's integrative, so she does supplements and antibiotics. And some doctors only antibiotics, and some doctors never antibiotics. I don't know too much about the therapies that I haven't done, obviously. But I do know that there are people do different things based on my research. For me, as far as I know, a diet is extremely helpful. Before I even knew I had Lyme disease, when I decided to go off of my medications for MS, and I went on a diet, and I was really strict on my diet, that helped me immensely. And it was just basically just a whole food diet. And I was really strict, and I made all the food myself, and I didn't eat any preservatives and anything like that, and that helped me a lot. Unfortunately, I don't like to admit that I'm not doing that right now, and I know that it would help me, but I'm not doing it right now. It's been hard for me to wrap my mind around Lyme disease and get used to that, and my medications and my supplements are changing a lot, so it's hard for me to adjust my diet. But I do try. I know that people have said that sugar and gluten affect them a lot with Lyme disease, so avoiding those helps a lot. And I know that to be true. I wish I was better at it, but I know it helps a lot.